Hi, my name is L.Ac, and I'm bringing you Acupuncture Mainstream one talk at a time. Today I wanted to go over some news I found from an article that was sponsored by Pure Branding. It's an August 2017 article that talks about it's a study of integrative medicine physicians, and some of the points that this article brings out are some of the characteristics of the relationship between the physician and the patient. And some of the key findings are, the integrative medical provider will tend to want to treat the root causes of your health condition rather than just the symptoms. Another was that they want to treat the whole patient, and this once again has this idea of not just treating symptoms but treating the whole patient. The physicians are focused on optimizing health rather than just disease management. So what's that mean? To me that means, well, if you have a pain in your arm, we're not just going to just stifle or suppress the pain in your arm. We're going to try to figure out, well, what is the cause of the pain in the arm? And there's another personalized approach to patient relationships. Okay, and accounting for the patient's lifestyle and their environment. So in this integrative study, in this August 2017 article, a lot of these characteristics, in fact all of these characteristics, are very common with acupuncturists. Acupuncturists can very well be part of that integrative medical clinic, of which there are many in the country and probably some in your own community if you look closely enough. So if you go to an integrative health clinic, and you'll also find integrative health medicine in the major hospitals. I know UCSF, I know has I think they have a very strong program up there at UC San Francisco Hospital. They have an integrative medicine clinic, and I know they incorporate acupuncturists there. And so one of the findings that I thought was very interesting later in the article is that the physicians usually spend at least twice as much time with their patient than they would have in a more conservative or conventional clinical environment. And I find that personally very true. When I'm with a patient, I don't like to be hindered by time. And if the patient has time, I like to spend time with the patient. And I think that's what a lot of us who are called into the medical profession, that's what we're called to do. We're called to help people. We're called to build that relationship that there's a trust in that relationship. Your health is a very precious thing, and while not every physician has the solution to every one of your problems, we do want to help. And I think that is really you take the Hippocratic Oath and you promise not to do bad things to people, but it's much deeper than that. And the whole concept of building that relationship, that there's such a health benefit to that, just especially in this world where people are complaining about not being connected. Yeah, we're connected through the internet. Yeah, you see my face, but I mean, how well do we really know each other? But when you come in to see a physician, man, you are really opening yourself up, being vulnerable to another human being. And as a physician, you have to really respect that, somebody coming in. Now, once again, not every physician is going to be ideal for every patient, but we do want to have the best, so we may have to refer out. But ideally, you have that very symbiotic relationship between a patient and his or her physician. So I just wanted to share some of those thoughts. I thought it was a rather interesting article. Pure Branding, it's sponsored by Pure Branding, August 2017. Search it on the internet and read it for yourself. So this is L.Ac with bringing Acupuncture Mainstream one talk at a time, and I'll see you on the next video.